The question we want to answer today is, does ketamine work for depression? I'm going to try to answer that in kind of three parts. The first one is, well, it depends on what we mean by the word work. There's no doubt that ketamine relieves to a substantial degree the feelings of depression, even in seriously depressed patients, about 60% of the time when they take an infusion. And this effect usually happens within minutes to hours. Okay? The benefits of this, however, seem to be short-lived and usually last between hours and up to 2 weeks, but so far of the studies, very few show a benefit beyond 2 weeks with a patient. And keep in mind that 40% of the patients don't get much of a response to it, even for the short term. The second part we want to talk to is that there are many limitations to using this drug for anything, but are using it especially for depression. First off, it's not an FDA-approved antidepressant. It is an FDA-approved anesthetic agent, but thirdly, it is also a street drug that is bought and used on the street for its effects, including its mood effects probably, but also perhaps other effects, and therefore has to be considered a pretty dangerous drug. Now, the second thing to point out, though, is that even in a medical setting, which is by far the only safe way to use this drug, even in a medical setting and in the clinics or the studies that have been done with depressed patients, it does have some side effects. It was known, after all, as a dissociative anesthetic agent, by which we mean that some patients get a feeling of that like the world around them isn't quite real, that there might be cardboard around them and not real stuff. And this phenomenon is sometimes called derealization or even depersonalization, and it can be a very uncomfortable feeling. This happens very little in the small doses that are used now in the depression clinics that use it and study it. But we did see a lot more of that because the drug was once used in higher doses in experimental studies decades ago to see if it would worsen psychotic illness, which it did seem to do in many patients. But it had more of those effects then. And it appears that it would be very likely to have many more of those effects if used on the street in high doses that people might purchase. Last thing, though, the question is, should doctors actually be using this clinically? It is still an experimental treatment. It is not FDA approved. But it is, since it's an approved anesthetic, it's legal for a doctor to do it and try to treat depression. And it's very hard to say that at what point we should stop trying to help a patient with depression. In fact, the answer for me is that we never stop trying. But I do want my patients to take all the proven treatments, okay, before we try experimental treatments for them. And so I wouldn't say never. I would say carefully and for a very small percentage of very severely depressed patients. So I hope this is a useful answer. Thanks very much.